Brad Williams, Frugal Finance, Medigap related definitions, where words in blue are defined. Assignment, an agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept the payment amount Medicare approves for the service and not to bill you for any more than the Medicare deductible and coinsurance. Coinsurance, an amount you may be required to pay as your share of the cost for benefits after you pay any deductibles. Coinsurance is usually a percentage, for example, 20%. Copayment, an amount you may be required to pay as your share of the cost for benefits after you pay any deductibles. A copayment is a fixed amount like $30. Deductible, the amount you must pay for health care or prescriptions for original Medicare, your Medicare Advantage plan, your Medicare drug plan, or your other insurance begins to pay. Excess charge, if you have original Medicare in the amount a doctor or other healthcare provider is legally permitted to charge is higher than the Medicare approved amount, the difference is called the excess charge. Guaranteed issue rights, also called Medigap protections. Rights you have in certain situations when insurance companies are required by law to sell or offer you a Medigap policy. In these situations, an insurance company can't deny you a Medigap policy or place conditions on a Medigap policy like exclusions for pre-existing conditions and can't charge you more for a Medigap policy because of a past or present health problems. Guaranteed renewable policy, an insurance policy that can't be terminated by the insurance company unless you make untrue statements to the insurance company, commit fraud, or don't pay your premiums. All Medigap policies issued since 1992 are guaranteed renewable. Medicaid, a joint federal and state program that helps with medical costs for some people with limited income and, in some cases, resources. Medicaid programs vary from state to state, but most health care costs are covered if you qualify for both Medicare and Medicaid. Medical underwriting, the process that an insurance company uses to decide, based on your medical history, whether to take your application for insurance, whether to add a waiting period for pre-existing conditions, if your state law allows it, and how much to charge you for insurance. Medicare Advantage plan, Part C, a type of Medicare health plan offered by a private company that contracts with Medicare. Medicare Advantage plans provide all of your Part A and Part B benefits with a few exclusions. For example, certain aspects of clinical trials which are covered by original Medicare even though you're still in the plan. Medicare Advantage plans include health maintenance organizations, preferred provider organizations, private fee-for-service plans, special needs plans, and Medicare medical savings account plans. If you're enrolled in a Medicare Advantage plan, most Medicare services are covered through the plan and aren't paid for by original Medicare. Most Medicare Advantage plans offer prescription drug coverage. Medicare approved amount, the payment amount that original Medicare sets for a covered service or item. When your provider accepts assignment, Medicare pays its share and you pay your share of that amount. Medicare drug plan, Part D. Part D adds prescription drug coverage to original Medicare, some Medicare cost plans, some Medicare private for service plans, and Medicare medical savings account plans. These plans are offered by insurance companies and other private companies approved by Medicare. Medicare Advantage plans may also offer prescription drug coverage that follows the same rules as Medicare drug plans. Medicare Select, a type of Medigap policy that may require you to use hospitals and, in some cases, doctors within its networks to be eligible for full benefits. Medigap open enrollment period, a one-time only 6-month period when federal law allows you to buy any Medigap policy you want that's sold in your state. It starts in the first month that you're covered under Medicare Part B and you're 65 or older. During this period, you can't be denied a Medigap policy or charged more due to past or present health problems. Some states may have additional open enrollment rights under your state law. Premium, the periodic payment to Medicare, an insurance company, or a health care plan for health care or prescription drug coverage. State Health Insurance Assistance Program, state program that gets money from the federal government to give free local health insurance counseling to people with Medicare. State Insurance Department, state agency that regulates insurance and can provide information about Medigap policies and other private health insurance. you have any questions related to Medigap, definitions, or other Medicare-related questions, comment. Brad Williams, Frugal Finance. Thanks for watching. Hope that helped. See you soon.